Dr. Lauren here. This video is aimed at those of you in possession of balls or testicles, because we're going to talk about doing a testicular examination. No hard and fast rules as to how often this should be done. Most guidelines kind of go around the monthly time frame. Best time to do it is after you've had a warm bath or a shower, so the scrotum is nice and relaxed. And what you want to do first is just have a look in the mirror to see if you can see any obvious external swelling or changes to the skin. And then when it comes to actually examining the testicles, what you want to do is use both hands, index and middle finger below and thumbs on top, and just roll the testicle between those two areas. Now, it's common for there to be a slight difference in volume between the two, and it might feel a little bit uncomfortable, but it shouldn't hurt. Towards the back of the testicle, you'll then feel a tube, a soft tube, which is called the Epididymis, which travels up from behind the testicle. It is quite common to feel a little swelling within that, or a little lump, epididymal cysts they're called, and they're very common. So other things, so obviously what you're doing when you're doing that is feeling if you can feel anything, a lump within the testicle itself. Other things that you might look out for are if there's an increase in size in one of the testicles, if there's a significant loss in volume of one of them, so one of them has gotten significantly smaller, if there's a heaviness of the scrotum, if there is a fluid collection, if you've got pain within a testicle, or if you've got breast tissue, so any increase in size in breast tissue or pain developing, painful breast tissue. All of those things need to be checked out. Now, other things that are not related to cancer, but you should get checked out as well if you're having the symptoms, would be burning when you pee, when you pass urine, if you've noticed any blood in the urine or in your semen, so within your ejaculate, or any other sort of changes to the scrotum itself. Now, the important thing to say is that most lumps or things that you will feel will not be anything to worry about. They will not be a cancer, but obviously the earlier cancers are found, the much better outcomes, and testicular cancer has really good outcomes. Which brings me to my final point, is never, ever feel embarrassed about going to a healthcare professional if you have a concern. If you think you felt something, please go and speak to someone about it, okay? As a healthcare professional, believe me, we've seen a million pairs of balls. We won't remember yours. And I would much rather be able to reassure you or potentially pick up something early that can be treated than for you to sit at home and die of embarrassment.